The number of cases of the coronavirus in Canada has now risen over 5,000. Now, most of those cases are mild, but according to Health Canada, there are at least 188 people in hospital. We are now about to speak to one of those 188. Erin Lee is from Chilliwack, British Columbia, but right now she's in a Calgary hospital after battling respiratory symptoms from that virus. And Erin has tested positive for COVID-19. Erin, first of all, thank you so much for making time for us. I just want to begin by getting a sense from you how you're feeling right now.
Okay, it's been a slow but steady progression. I've never experienced any illness like this before in my life.
If you need to take a break, to cough, anything, if you feel like the interview is too much at any time, please don't hesitate to tell us. So we'll take a break whenever you need. But when you say you've never experienced anything like this before, Erin, what do you mean when you say that?
Just not being able to breathe. The amount of pressure in my chest, the burning. Obviously, like I said, the main issue is shortness of breath, which is worse with any type of exertion. And the coughing kind of comes in waves. So it's been a little bit bad today. But those are my main symptoms, body pain.
And do you know how you got the virus?
No, we assume it's community transmission. I have not been out of the country. I have not been around anyone that has gone on a vacation. And I don't know anyone that has tested positive for COVID.
So you don't even know if a friend has it. You don't know how you got it, like, or even a potential from where you got it.
No idea.
And how long have you had it?
I've been symptomatic. This is my 10th day now.
Your 10th day. How long do they anticipate you're going to remain in hospital?
Until sometime next week is the thought. I guess average hospital time is about 10 days.
And you're currently on oxygen. We see you all plugged in, for lack of better phrasing, but how long will that stay the way it is?
It's very minimal right now. We've been decreasing it every day. We did attempt to come off of it totally yesterday morning, but my oxygen saturation dropped. So my lungs just weren't quite ready yet. So like I say, I'm on a minimal dose of oxygen. So I would assume another day or two and they'll test me again.
Are you alone there, Erin? Because we mentioned that you're from Chilliwack, but you're in Calgary right now. So is anyone there with you, taking care of you?
No, my immediate family is all in Chilliwack. There is no point in them coming here because I'm not allowed any visitors anyways.
Right. You gave us a sense of how you're feeling physically. How are you feeling emotionally, psychologically?
It's getting a little bit lonely in here. Unfortunately, the window doesn't go to the outside, so I haven't seen the light of day since I came in on Tuesday. So that's a little bit depressing, but the staff here have been amazing. So at least it's been a good experience with them.
Were you at all sick before you contracted the virus? Were you a healthy person before this thing got you?
I did have some underlying cardiac issues that I was dealing with. So I would consider myself immunocompromised.
Okay. There are still people in Canada, for the most part, everyone's taking this quite seriously. But you know, there are some people who are still not fully on board with physical distancing. They're still going out to parks with their children. Aaron, if you're still with me and you're still able to, is there anything you want to tell people who maybe don't take this thing seriously enough yet?
Yeah, it's time to listen to what the top doctors are saying. This virus is so unpredictable, and it can hit hard and fast, and it can hit anyone of any age and any level of health. So I would beg that people please do listen to what the government is asking us to do and stop the spread, since one person can infect so many people.
Have they given you at all a sense, Aaron, of what is going to happen once you leave the hospital? Are you going to be left with any sort of condition that will stay with you, or do you fully recover from this thing? What happens from now on?
I don't think people know. I have asked that a few days ago, and the answer I was given is they don't know. It's so unpredictable. It hasn't been around long enough to know if people do have some kind of long-term effects or lung damage from the virus.
Okay, we are all wishing you the best. Anyone watching this wants you to recover and feel good. I really want to thank you so much for sharing your story with us. Just healthy vibes projected at you. Get better. And you know, as soon as you're back home feeling good, we want to check in with you again, okay?
Thank you very much.
Thank you, Erin. You take care of yourself.
Bye-bye.